using our voice to rate your choice. Stay tuned.
Ladies and gentlemen, you are tuned in to 90.8, the first ever community radio station in Nagaland, located here in Dimapur. And this is Arihant Jain, and today I am back here with a special episode of our content. And our guest today here is very familiar with us, already like a family to us now, as he has, already been here 2 times. Any guesses? Well, it's none other than Sir Arihant Jain, an orthodontist. I know the name sounds quite familiar, right? Now, some of you guys might be wondering who or what an orthodontist is. So, in short, an orthodontist is a type of dentist who specializes in strengthening teeth and fixing bite problems. They use braces, clear aligners, and other tools to help teeth move into the right place. So listeners, as we have a short conversation here, please stick with us till the very end as Sir Arihant shares his knowledge with us. And it's going to be more like a short consultant, so you might not want to skip this one. Alright, sir, thank you so much for, taking out your time from your busy schedule and visiting us once again. And in case, if I've missed out anything on the introduction, would you please like to add up something?
Okay, thank you so much first for having me over here. And it's really a pleasure being here, and we'll be discussing a lot about orthodontics in general, which is definitely a specialty of dentistry. See, I'm an orthodontist. I'm a dentist by profession, a dental surgeon, and my specialty comes being as an orthodontist.
Okay.
The full designation which we give is called as orthodontics and dentofacial orthopedics. So what comes over there is we are the ones who are in charge of our jaws. Okay, the upper jaw and the lower jaw, and the extra oral, as we say, the face structure. So we are the in charge for that. So the correction of your jaw, your bite, your deep bite, your overbite, your smile in particular, your crooked teeth, teeth with spacing, teeth which are forwardly placed, teeth which are placed a little bit inside. You are unable to eat food properly. The bite is not good. And when you look from your face point of view, the extra orally, then it comes as in like how your face looks, your jaws looks, your jaw is big, small, and all those things.
Okay, I am so excited to see with you, sir, today, because for the longest time, I have been wanting to, talk this kind of conversation, and I'm so honored to have a conversation with you today. So I am gonna, start off, shoot you with the first question. In which scenario can people approach an orthodontist for treatment?
See, usually what we say is anyone should have an orthodontic consultation, and then the orthodontist will be the person who will tell you what are your problems. Okay. In short, when I meet my patients and I talk to them, I ask them, okay, we'll mix it up with a little bit Naga missiles, na? So, kini kahina bishi time patient kan moila usore aaye. To tai kan hota thake na ki doctor moila usore ki problem ase, moi ke braces lage na lage ni na. To udu time mola first conversation, the first question doctor patient kan ke thake. First apni goibe apni ke braces lage na lage. Are you happy with your smile or not? Second question is bhat kha time de, chew kora time de, do you face any difficulty or not? These two are the questions. Are you happy with your smile or not? Can you eat food properly or not? Ito duita question la answer la hisab te hi thage whether you need braces or you don't need braces.
That is a very, very nice answer. Okay, thank you so much. And moving on, I'm sure apni agi devi mentioned Gorje, but to orthodontists cater to oral health disease like tooth decay, ito kan labi, aro gum issues kan ito kan la devi.
See, orthodontist jinika dental de na, moi khan dental profession de total 9 different specialty thage. So one of them is orthodontist, who take care of your smile, your placement of your jaws and all na, itola. Aru tooth decay karne bhi alag ekta specialty ase, gum disease karne bhi alag specialty ase. So they are the ones who are specialists for taking care of this.
Okay. Yes. Thank you so much for that answer. Ekdam, to the point tishi apne. And moving on, I have also heard about how can, untreated orthodontic issues affect long-term health beyond just crooked teeth?
Okay. See, ajikali how the things are changing in the world. Na, to moi khan ini ga nai ki crooked teeth ase, smile bia ase, hoise, health hoise. Even the World Health Organization, na WHO, tate bhi hudala, what is a good health? Na, a healthy person te very important perspective ki thage is apni la mental health. Mentally you are fit or not. That is important to describe or qualify you as a healthy person. So bishi time means maximum way la patient khan la ki problem thage smile bia ase na, so they will have a mental issue. Mental issue in a sense, try to understand. Someone is not happy. Mental issue means ini kahi nai ki pagla manu khani mental issue ase. Mental issue means apni you are not feeling good, you are not happy, you are sad. That is something which is bothering you. Okay, if someone is not confident, someone is being a little bit reluctant to go on stage, to smile, to talk to people, because they have that phobia that acha moila smile to bhal na dikhe na. So that smile bhal na dikha karne tai kotha koribole sorom khaye, smile bhal na dikha karne tai smile koribole sorom pae. These are the mental blocks. So this is where the thing where I would say that your first part, that if you don't, your crooked teeth will affect you. Second part comes is, see, ajikali study para pishi studies hoye thake na, moi khan labi medicine or dental department khante. So there have been one study where tate ki dikha ase na, apni la jaw position bhal na thakile, if your jaws are not positioned well, itu apni la back problem te bhi, neck problem te bhi effect koribo. Means apni nijor bhabna koribe, apni chola time te duita thing para chole na, to ekta thing para crooked ase, ekta thing aru olop tera hoi kena chola ase. Itu apni ke back problem bhi dibo, to thing tera ase hole bhi back problem ho ase. Same way moi khan la muk la bina niche la jaw juntu moi khan mandible koi na, lower jaw koi, itu bhi kini ase na, it is also connected near our ears. So this joint we call it as temporomandibular joint na. Itu to bishi detail hoise hoile bhi koha to, it is also a type of joint na. To apni la joint bhal nai, apni la jaw position bhal nai, to it is also gonna affect your whole body in such. So that's why your crooked teeth, it affects your smile, it affects your confidence, it affects your overall health also. And then the last I would like to add is, crooked teeth thagile, it simple as a apni la dan tera mera ase, brush kurubole na pare. Brush kurubole na pare, dan ganda ase. Now there is, like, it's not recent, it's a very old study now, it's a documented study kind of thing. Apni la dan ganda thagile, apni la mu ganda thagile, apni la mukte infection thagile, juntu bacteria mukte thage na, same bacteria cardiac disease means heart disease the bhi thage. To apni la mukte ganda ase, apni la mukte infection ase, to apni la chance to get a heart disease increases. Itu bhavna means apni la dan tera mera ase, dan clean koribole na pare. Na hole itu to moi ko na dan sidha bhi ase, hole bhi dan apni bhal para clean na korile, mukte infection thagile apni ke heart disease hole chance thage. So that's why oral health is very, very important. And if I say on your behalf to the viewers and the listeners, moi khan to aji la juntu talk kora ase, because we are celebrating our World Orthodontic Health Day today. So World Orthodontic Health Day means where even in the world we are promoting and giving people awareness regarding orthodontic health, your oral health, and why your teeth are important, why your gums are important, your bone is important. Even in this speciality, moi khan la naam te hi orthodontic ase. So means it's the correct positioning of our teeth, okay, in the jaws in particular. So yes.
Listeners, sir, by month, pal TikTok par gui dishe. Now, as you have heard, Aji World Orthodontic Day, which is the 15th of May. Okay, every year itu time din na. Itu din de celebrate guri dege. So sir has tai iman busy schedule para time ulagi na. He has given us some time, so stick till the very end. We still have a lot of more questions to ask him today. So now moving on, I've also heard about Invisalign, right? Yeah, Invisalign. And I'm sure our listeners would love to know more about it, especially its benefits, risk, and then, whether it's expensive or not. The most important thing.
Okay. See, Invisalign is what? Invisalign is a type of aligners. Aligners means, what is its function is to correct your teeth position and your jaw position. Okay, so the tagline for it is clear alternative to braces. Kinika hoy bishi time manu khan braces lagabole kiman kile karne duk pae na kile karne shorom pae is I don't want braces dikha do. Braces dikhibole shorom pae. That's first thing. Second thing, apni adult hua time de means apni 20, 25 plus, 30 plus inika time te hua time te apni nijer college te ja ase na apni kam kora ase na apni shadi huise na apni office inika ase na hoile apni iman age te hoise probably 45 50 years hoise apni to itu time apni showroom ba ase ai itia to braces na cholabo utu time te Invisalign is an option which is said to be the clear alternative to braces. Moi khan itu ke plastic braces bhi koy na invisible braces bhi koy. To manu khan itu cholaile apni la dant la position thik hobo, apni la smile thik hobo aro itu bora apni dikha komti ase to apni la juntu problem thagise ki acha dikhibole showroom ase itu bhi na thakibo.
Okay. So function to iki ase like the braces.
Yes.
But solely less visible.
Yes. See, major apni difference hodi wo to major difference to itu hi ase ki dikhibole na dikhe. Aro bhi difference ase means time sabi. Invisalign kini hoy na itu plastic braces ko to itu moi khan means clinic te banabole na pare. Itu kini hoy apni la dant la measurement lui ke na moi khan alag alag lab te pathai. To Invisalign kile itu to actually aligner ase ha to aligner Invisalign ekta lab ase lab la naam ase juntu invisible aligners banaye itu hi actually lab ase juntu first time itu aligners ke invent korise and that was done it was shown in one of our conferences in 1999 which is almost now 27 years 27 years back in USA America de itu tai khan invent kurigena tai khan document kurise moi khan la conference te to it's the first lab which they did so patient khan karne kini ka ase apni la dant la measurement te itu Invisalign na aligners banaye especially for you so it's very very customized to customized thage to apni la juntu treatment thage it is braces pora compare korile apni la treatment all of fast thage okay braces to ki thage braces are almost in 90% of the cases moi ko ado braces to similar thage sab patient karne same braces hi dante lagai kini ka lagao dante kun position te lagao all of right all of left all of upor all of nicha itu to doctor decide kore hoile bi itu braces hi dante cholai dante chola braces pichete kuntu wire lagao kuntu wire kiman tight koribo itu to patient la hisab te change kore hoile bi Invisalign to ki thage apni la hisab te hi banai kina avo apni la dan age koribole lage piche koro itu hisab te hi banai especially for you to itu apni la aligners to na apni la Invisalign to alag kun bi manu kan use koribole na pare kile size fitting la issue thagibo next to jinika thage jinika koise itu karne itu because it's made specially and only for you it is the treatment fast thage all as compared to braces alag manu khan koa to kinika thage because it's a system where apni bhat kha time te brush kora time te cha coffee kha time te apni itu invisible braces ke dan pra ulabole pare normal braces to kinika thage 24/7 apni la dante doctor lagaise itu jitia tak treatment cholebo itu mukte hi thagibo Invisalign to ki thage apni nijor lagabole pare nijor ulabole pare to itu la advantage ase aro comfort karne bi itu ase apni bhat kha time te apni nijor ulaibi bhat khai libi braces te kinika thage apni ke tan saman khabole allowed na thage ki bi tan saman kacha chana kacha mata supari haddi apni tan saman khabole na pare Invisalign treatment kora to apni ulaibi ji khabole mon ase khaibi brush korbi aram pora to comfort bi itu inika thake aro appointments bi kile treatment fast ase appointments bi olob komti thake aro apni jinika huda to expensive so itu expensive kinika hisab te thake apni kuntu lab para itu ke bana ase na to apni Invisalign juntu America la lab ase itu para banaile olob to costly thakibo aro alag alag lab thake India te bi lab ase tade para korile apni la treatment charges olob different thakibo hole bi expensive koala মই ইম্পৰ্টেন্স না দিব মই কোৱা তো ইম্পৰ্টেন্স আছে ইটো আপনি কিমান এফৰ্ড কৰিবলে পাৰে না ইটো তো আপনি নিজৰ হি ডিসাইড কৰিব কোন পেশেন্ট কাৰণে Invisalign পাৰিলে Invisalign কৰিবি কোন পেশেন্ট ব্ৰেসেস পাৰে ব্ৰেসেস কৰিবি সবলা अलग अलग এডভান্টেজ ডিসএডভান্টেজ আছে ইটো তো পেশেন্ট নিজৰ হি ডিসাইড কৰিবলে পাৰে
তো আপনি এতিয়া এইটো কোৱা টাইম দি মোলা মুন্দি আৰু একটা কোৱেশ্চন আহিছে চ' ইনভেজিলিন হলিবি ব্ৰেচেছ হলিবি এইটো লাইক পাৰ্মানেণ্ট কাৰণে আছে না লাইক আৰু ইউজ কৰি থাকিব লাগে
सही ताइखानला
Changes तो।
हाँ ताइखानला तो एकता ट्रीटमेंट प्रोटोकॉल और ट्रीटमेंट स्केड्यूल थाके फॉर एग्जांपल ब्रेसेस तो किनेका थाके अपनीला दांते ब्रेसेस लगाई दिए डॉक्टर और डॉक्टर पीछे ते एवरी अपॉइंटमेंट मींस यू सी मैं फॉर एग्जांपल नॉर्मल गो तो 1.5 ईयर अपनीला ट्रीटमेंट चलेबो ब्रेसेस ते अपनी प्रोबब्ली 1-2 मंथ्स ते अपॉइंटमेंट करने जाओ ताते डॉक्टर वायर चेंज करिवो वायर टाइट करिवो इतुखान करिवो ब्रेसेस लगाई किना थाके ब्रेसेस ते एकता वायर भी थाके तो वायर चेंज टाइट की भी करिवोले लागे इतु डॉक्टर करिवो इनविजिलाइन ते की थाके अपनी इनविजिलाइन जो प्लास्टिक ब्रेसेस थाके ना इतु अपनी ला ट्रीटमेंट हिसाब ते अपनी 10 पीसेस 15 20 22 25 27 30 मींस अपनी ला ट्रीटमेंट हिसाब ते इमान प्लास्टिक ब्रेसेस पावो तो अपनी ब्रेसेस ते डॉक्टर ला ओसोटे जाए डॉक्टर वायर चेंज करे वायर टाइट करी तो थाके इनविजिलाइन ते किनिका थाके इतु अपनी निजोर अपनी ला हाथ ते थाके अपनी नाउ ट्रीटमेंट ला हिसाब ते कुन पेशेंट के इनविजिलाइन 1 वीक लगावले लागे कुन पेशेंट के इनविजिलाइन 10 days कुन पेशेंट के 2 weeks लगावले लागे दैट इज डिफरेंट फॉर सब पेशेंट करने डिफरेंट असे अपनी इनविजिलाइन लगावो एंड आफ्टर सपोज आफ्टर एवरी 10 days अपनी इनविजिलाइन चेंज करो तो इतु भी नंबर ते आए सेट 1 सेट 2 सेट 3 सेट 4 इनिका आए तो अपनी 1 मींस 10 days सेट 1 लगाइछे नेक्स्ट 10 days सेट 2 नेक्स्ट 10 days सेट 3 तो इतु किनिका चेंज करो किना असे इतु तो सब पेशेंट करने अलग अलग थाके तो इतु तो अपनी ला निजोर ला ऑर्थोडोंटिस्ट ही कोबोले भाल परा पारिबो
Okay. Now we're gonna move on. Next question, DJ Joel. What advancement in orthodontics should patients be excited about right now, especially those who have delayed treatments?
See, advancement कोहा तो आजिकाली जिनिका artificial intelligence कोइशे आरो आजिकाली digitalization हुआ से तो मोइखान ते भी digital dentistry आइशे. So one of the example of digital dentistry is Invisalign. तो Invisalign भी जिनेगा मोगे 27 years आगे ते आइशे. होइले भी इतिया तक भी like मोइखान ला last summit जुन्तु थाकिशे चेन्नई ते थाकिशे in the month of February. तो मोइखान ताते जाइशे तो ताते आरो Invisalign ते भी एकता new modification आइशे. तो इतु हिसाब ते every 6 months 1 year ने की ना की अलग अलग advancement ना आए. तो most advanced is digital dentistry. आरो इतु दे Invisalign is one of the part. Then second part is आजिकाली तो मानु खानला जुनला हड्डी खान भी थाके ना हड्डी भी चेप्टा आसे ना हड्डी भी बिशे constricted आसे और अच्छा इतु भी connected आसे अपनी ला breathing दे ना like I'm just giving you one knowledge means बिशे टाइम मानु खान कोई ना कि मोई खान भाल परा मुक नाक परा सांस लोले ना पारे मुक परा लोए तो there can be a problem कि अपनी ला नाक ला जगह ते ना जगह ही कम दिया से because अपनी ला ऊपर ला हड्डी overlying space लुई के ना आसे तो if अपनी ला हड्डी ठीक करे बोले पारे तो अपनी ला नाक breathing space भी improve हो जाए तो अपनी सांस भी ओलो भाल परा लो बोले पारे वो improve हो वो after your braces treatment तो इतु करने भी advancement आहा से next तो advancement को तो आजिकाली means कुन मानु खानला ना सेबी हड्डी छुटू थाके तो हड्डी छुटू आसे ना हड्डी डांगोर आसे the jaw position is not good तो इतु करने आगे थे तो किनिका था कि orthodontic surgery ठीक है इतु orthodontic surgery भी means one of the people who do orthodontic surgery इतु तो orthodontist था के इतु टीम थे ना तो the planning of the orthodontic surgery की किनिका करी बोले लगे किमान करे इतु तो orthodontist ही करे तो ताते advancement की ऐसे first थे तो मोई खान सब x-ray लुई के ना paper दे x-ray drawing करी के ना मोई खान प्लान करा থাকিছে कि किमान किनिका सर्जरी हो किनिका किमान एमएम हो किमान डांगोर करिवो छुटु करिवो तो आजिकाली तो एडवांसमेंट किनिका जे सब डिजिटल डेंटिस्ट्री आपनी ला एक्सरे लैपटॉप ते जाओ लैपटॉप ते सॉफ्टवेयर आसे सॉफ्टवेयर पर पूरा एंगल उलावो आपनी ला हड्डी किमान काटिबोले लागे किमान डांगोर करिबोले लागे तो दैट इज आल्सो वन of the advancements which is happening from the past few years.
Okay. Itia to moi personal ta hadiwo treatment, whatever kind of treatment, of course, relating to teeth, of course, does it hurt? Bishi bagana na.
अच्छा से अपनी इधर तो दांत ला ट्रीटमेंट करने को आसे ना ब्रेसेस ट्रीटमेंट करने हो
ब्रेसेस हुई दांत ला हुई
अच्छा से मोई खान ला डेंटल देना मोई खान एक तास कॉमन स्टेटमेंट की कोई ना dentistry is not expensive neglecting dentistry is expensive. Okay. Itula ki meaning ase apni la dante ekta chotu kira hoise na. Itu means agite means normally TV bi na agite bi manukhan beshi huda means huna ase ki you should visit a dentist every 6 months. Itu kile koa thagise na. Means kini ase apni la dante na olop chotu kira hoise na. To itu kira aji na bikhabo. Hoile bi apni muk te bhal pra check korle kun jaga te black spot nishina thakibo. After 1 year 2 years nishina tate bhat kha time te khana stuck hobo. Idula bi time de kini kahe patient khan goy aya khana to stuck khora ase hoile bi iko nai chari dibi na bikhai. Itu piche te bi 2 years 3 years piche te bikha start nijor dan bikha start koribo. Uto time te dan beshi bikha ase. Itya apni itu stage huni na. Stage 1 ase jun dia apni la cavity start hoise kira start hoise. Stage 2 ase jun jaga te apni la khana khan stuck ho ase. Stage 3 ase apni bikha ase. Aru stage 4 ge ase aya dan to pura poka khai ke na nijor hi bhangi kisne. Bhat kha time te olop kore ke na bhangi she. To stage 1 to 4 ase na. To apni bhabna koribe apni doctor la osorde jaile. Stage 1 means apni regular checkup jini ka question na apni kun bi apni la dentist te jaise in every 6 months to doctor tate check koribole paribo acha yate to kira lagise to apni filling korai lebi kira safa koribe filling koraibe to itu kira safa kora stage 1 te apni kira safa koribo filling korile probably 15-20 minutes lagibo
true
khorcha bi thagile 1000 rupees nishina lagibo thik ase to stage 1 kira chutu ase 15-20 minutes la treatment khorcha bi 1000 rupees Stage 2 te aibi khana phasa ase apni itia bi means itia tak bi doctor te ja na na khana means regular checkup te na jae itia khana phasa ase apni koi je aya chalo thik ase itia to doctor te jabole lagibo dentist la osorde to apni dental doctor la osorde itia stage 2 te jaise itia treatment korole 30 to 45 minutes lagibo aro apni la dan bi olop komjor hoise kile dant natural dant olop to bhangise na itu karne khana jama hoa ase na tate to dan bi komjor hoise টাইম বি বেশি লাগি আছে খরচা বি 2000-3000 যাব ঠিক আছে হইলে বি বেশি পেশেন্ট খান ইতিয়া বি না যায় স্টেজ 3 তে বিখা আছে ইতিয়া বিখা আছে ইতিয়া আপনি ডক্টর লা ওসরতে যাব ইতিয়া ট্রিটমেন্ট করিলে আপনি লা খরচ মিন্স টাইম কিমান লাগিব probably doctor apni ke go 2 appointments 3 appointments 4 appointments karne aibi dan bikha ase means chances ase apni la root canal treatment RCT koa to itu jabo itia apni doctor la osorde ja ase apni la treatment kora to 3 appointments 4 appointments जाओ तो सभी आ जा भी टाइम जाए ना खर्चा भी जाए ना पीछे ते खर्चा भी हो दिले 5000 निशिना जाओ तो ये तो अपनी भावना करा से ट्रीटमेंट दान भी कमजोर हुआ से स्टेज ते टाइम भी बेशी लगी से खर्चा भी बेशी आसे स्टेज 4 दान थी खत्म इतिया तो असली दान जुन तो नेचुरल दान जुन तो ईश्वर दिशे इतु खत्म इतिया दान तो डॉक्टर दिवो इतु तो खर्चा भी बेशी दांत भी सभी नेचुरल दांत ला रिप्लेसमेंट तो की भी नहीं तो अपनी आर्टिफिशियल दांत लगा तो ये तो दांत भी आर्टिफिशियल है दांत भी अपने ला दांत उलागा करने भी झमेला पीछे ते दवाई भी खावले लगे ट्रीटमेंट करने भी झमेला और इतुते नकली दांत लगा तो बेस्ट ऑप्शन आजिकली तो इम्प्लांट्स करेंगे ना थागे डेंटल इम्प्लांट्स लगा तो 4 months 5 मींस फुल प्रोसेस ते नॉर्मल पेशेंट से 4 to 5 months लगे आज इम्प्लांट लगाओ 3-4 months पीछे ते ऊपर ते क्राउन लगाए ना ये तो हिसाब था ये खर्चा भी जाए तो 25,000 30,000 35,000 जाए दांत भी जाइए स्टेज 4 ते दांत भी जाइए खर्चा भी ऐसे और
टाइम भी चाहिए
सब चाहिए तो इदु करने अपनी ला खुदा क्वेश्चन तो इस डेंटल ट्रीटमेंट पेनफुल अरे बाबा टाइम दे जाओ डेंटल ट्रीटमेंट बेशी आराम बड़ा हो दैट्स व्हाई विजिट अ डेंटिस्ट एवरी 6 months
A to Z answer good is आपने इतना I don't have any confusion any question regarding to that so itya you know one thing that every parent or adult patient knew before starting or skipping orthodontic care
so for इदुते मेजर रो किनिगा होइना मोइगे पेशेंट्स खान होदेना कि by what age should be first do an orthodontic consultation na तो इदुते moi khan koe to 6 to 7 years of age is the first or the initial time when you should visit an orthodontist for your orthodontic consultation apni la dan thik ase na nai kile bacha dan bi apni la tera mera thagibo bacha la dan bi apni la kira khai kina ase to jaws development effect thagyo to that's the reason that you should apni ke 6 to 7 years te apni ke ekta orthodontist ke visit korile bhal ase 6 to 7 years piche de apni la braces acha aro ekta confusion ase manu khan bishi time moi ke patient hola to tai khan koy moi khan to inika huni gena ase ki braces to 13 years 14 years te laga aya itu to purana story ase means 50 years purana story আপনি হুদিছে না আজিলা কারেন্ট এডভান্সেস কি আছে তো কারেন্ট এডভান্সেস তে বেশি ট্রিটমেন্ট ইনিকা আছে কি আপনি 9 ইয়ার্স 10 ইয়ার্স তে ট্রিটমেন্ট লয়ে অর্থোডন্টিক ট্রিটমেন্ট লইলে আপনি লা রিজাল্ট বেশি ভালো লাও না হইলে আর বেশি ট্রিটমেন্ট ইনিকা থাকে আপনি 14 ইয়ার্স 15 ইয়ার্স তে অর্থোডন্টিস্ট লা ওসরতে দাও তাইখান করিবলে বি না পারে For example, go to bishi patient khan la inika thage haddi chutu ase like niche la haddi na upor la haddi means lower jaw or upper jaw. Lower jaw apni la chutu ase na upper jaw chutu ase na lower jaw dangor ase upper jaw dangor ase. Itu treatment to jitia bacha khan dangor ho ase. They are growing means and the growing age is still 11, 12, 13 na. Utu time tak tai khan grow kora ase. Utu time tak apni itu la treatment korele result bishi bhal ulao. Result treatment to 15 years te bhi paribo 20 years te bhi paribo hile bhi result to iman bhal na paribo aru itu bhi koa result simple treatment to apni la 9 years 10 years te hoi jabo idui apni 20 years te bhabna koribo moila haddi thik koribi 20 years te haddi thik kora time te apni ke orthodontic surgery na cosmetic surgery korabole lagibo to treatment kun to aram ase 9 10 years te kora juntu ekta normal plastic na plate pora thik hoi jabo haddi la treatment
So it's always better to start as soon as possible. Pachatam di ko 6-7 years.
Let the orthodontist decide it. Means apni doctor go and visit your orthodontist. Tai khan la osore jaibe. Tai khan apni ke advice kori dibo ki apni karne ki bhal ase.
Okay. Listeners, I hope today's conversation though, for me it's like I'm having a huge meal right now. I'm filling up so many things. I hope it's the same case for you as well. Now, Mugan, our next question di jao. What should patients look for when choosing a qualified orthodontist, especially in the era of flashy marketing? Because actually, nakli bhi ulai, aro kishim bhi ulai thake na. So, one thing that you would share to our listener.
Acha, so jininga moi khan koise for in the terms of qualified orthodontist is so moi khan la na national te ekta association society ase Indian Orthodontic Society. So Indian Orthodontic Society first of all sub or tai khan la orthodontist khan ke qualified orthodontist inika grade kore. So when you visit an orthodontist you will find tai khan la clinic te na inika certificate bhi thagibo qualified orthodontist la na IOS Indian Orthodontic Society na to IOS certified qualified orthodontist ekta to itu ase second to moi ko flashy marketing la era te na see the best way to determine kun orthodontist bhal ase na nai try to talk to their previous patients to ajigali time de Instagram de na Facebook de na Google de apni patient khan la reviews bhi sabole paribo Instagram de bhi patient la reviews sabole paribo na hoile kun manu khan braces chola ase na inika ase to tai khan ke bhi apni hudi bole pare acha apni la orthodontist kinika ase to there's nothing better than the mouth advertisement okay so the mouth advertisement is like let your patient speak for yourself okay you apni la patient ni apni karne advertisement koribo na to idu to that's the best way to find out a good orthodontist for you.
Okay, very well said. Now, is there any age limit where orthodontic care gets dangerous, risky, or less helpful? Akide, you have added something, but deeper.
Okay. See, jininga moi koise the starting age is like 6 to 7 years na aru end age to kibi nai end age is acha personally moi pura huda to for me the oldest patient which I have did which I have treated is she was 59 years old 59 years old tai ekta teacher thagi je
Acha.
and to make you feel good she is from Mokokchung okay and itu treatment bhi moi kora to I think 2016-17 la kotha almost 9-10 years back to tai moi la osore aise 59 years old tai koise taila smile taike bhal na dikhe tai to braces treatment kuribole mon ase kuribole paribo na na paribo
acha acha
to first thing moi khan karne check kora thake tai khan la see age is never a limit for orthodontic treatment what is a limit is your bone health if your bone sabi apni la dant moi khan na orthodontics te moi khan dant la treatment as such na kore na moi khan haddi la treatment kore apni la haddi tera mera ase to moi khan haddi ke thick shape te ane aru dant ke apni la original dant ke hi haddi te reshape kore de reposition kore de realign kore de means apni la nijor la dant ke in a perfect position te moi khan align kore with the help of braces to apni la haddi la position thik hoye to apni orthodontic treatment kora time te all your orthodontists will ask you to get certain x-rays to check apni la haddi la condition condition thik thakile apni 60 years te bhi treatment koribole pare aru apni la haddi thik na thakile recently it has happened that I think a 14-15 year old boy I can't do the treatment kile taila haddi thik nai to jiniga moi koise your age limit to I did the 59 like the treatment for the 59-year-old teacher and for me moi karne bhi to first time thakise na ki moi 59 years old la patient treatment kora ase aru taila treatment khotom hua time te tai senior citizen hoigina retire bhi hoise school pra to moi taike hudise start kora time te ki means moi la bhi curiosity thakise kile iman dangor patient na kitia bhi aha nai treatment karne na moi taike hudise to the thing which I struck my heart was taila statement she wanted during her funeral and obituary Taila's photo to smiling ulawole lage that was her vision she said that all my life I could not because of this that so many duties in life family kids I could not get my treatment done but now I want to get my treatment done and is it possible or not moi khan treatment korise taila smile bhal hoise aro hosa goala kota to last week moi khan aru ekta patient end korise taila hi satni thakise aru taila satni to means satni ko na colleague ko school te hi taila age bhi 55-56 years thakise taila treatment moi khan khotom korise and yeah it's a treat to for us it's a blessing ki moi khan bhi teachers khan ge na iman elder khan ke beautiful smile dibole pare
okay so listeners I think that is a ray of hope na to apni kan komba if you guys are hesitating chauna nai deri huishna honai ina phabina thagi ase guli to joldi na aji sir Arihant la clinic visit grilubi right and while talking about that let's talk a little bit mogan listeners can where they can find you let's talk about a little bit about your clinic as well
so if you don't mind really sorry moi ko to say moi to dimapur de thake na hoile bi bishi patient kan huna manu kan listeners kan to kohima de thakibo mokokchong bokha de thakibo to tai khan to dimapur aha na pare to main important ase apni tate hi apni la karne ekta orthodontist bisari le ajikali to government service te bi orthodontist ase kohima de bi orthodontist ase sabi apni jun jaga thake peren kifri kun jaga de tate ase na nai etu to moi na jane hoile bi alag jaga te ase try and find in the nearest orthodontist and tate jaigina treatment korolibe sabi sab orthodontist moila hisab te bhali ase kile sabi orthodontist bana do iman easy nai to become an orthodontist first you have orthodontist is actually a specialization of dentistry na to udu de apni ki ase apni 5 years first then 5 years dentist hua karne apni college te thake like to get your graduation degree of BDS bachelor of dental surgery na to apni itu lua 5 years lage you become a dentist you become a dental doctor after that you have to study 3 more years to do your post graduation and your masters to become an orthodontist so couldn't be orthodontist hua to they have studied for 3 more extra years okay they have become an MDS doctor master of dental surgery and orthodontist so couldn't be apni la ghor la osor de thagile apni khan means jaigina tate hi bisari lewe kile dimapur aha to dur thagile because it's not a one day treatment na bishi time ek saal la treatment thage to ek saal la treatment do apni bi aha ja kile moi kile itu ko ase na jinika itia just moi koise moi la patient do mogok chong bra to তাইতো 10 years আগে লা কৰা কথা যায় উটো টাইম দে roads বি ইমান ভাল আজিকালি তো roads superb হৈছে উটো টাইম দে roads বি ইমান ভাল থাকা নাই তো তাই লা মেইন প্ৰবলেম কি থাকিছে এপইন্টমেন্ট কাৰণে তাই bolero তে ফ্ৰন্ট ড্ৰাইভাৰ লা ওচৰ লা সিট পাইলেহি তাই আৱলে পাৰে কেলে তাই বি অলপ এজ হৈছে তাই কোৱা পিছলা সিট পাইলে তাই আৱলে না পাৰে তো ইটো কাৰণে আপনি ওচৰ orthodontist কি বিচাৰি কেনা আইলে ট্ৰিটমেন্ট কৰিলে বেছি ভাল
Okay. But magan Timapur they reside kora manugan Timapur, Timun, Yulin, they need to know na dito gani.
Acha. So moila I'm a consultant orthodontist. I'm working from the past Dimapur days. This is my 10th year. Dimapur day kam kora to I am there available in certain clinics and hospital also.
Okay.
And moila nijor la clinic to Jasuki Market GS Road koi na. To New Market la osorde Dhovinala la osorde ase braces and implants dental clinic kore kina. To itu apni Instagram te Facebook te Google te sab jagah te sabole pare.
Okay. Listeners, with that, we'll take a short break here and we'll be back very quickly with more interesting questions, so make sure you stay tuned. Welcome back to our conversation. This is Jain still here, and our guest, Sir Arihant, who is an orthodontist. Now, we are gonna, now before asking about further about any other things, let us talk about Orthodontic Day. Like every year, mujin akitibi kuta grid but every year 15th May Day, it is celebrate grid again. Now, like one reason why it's important to celebrate, or like how it's celebrated, ito tuita de olop kuitibi. Mugan la listeners kange.
Kini nga thake na by our World Federation of Orthodontists. I'm also a fellow member of it. So moi khan la itu World itu association te because of the lack of the awareness of orthodontics. Jinika aji apni ke hudibo. Probably aji la conversation te bishi means apni la questions par apni bi answers paise. To itu hi hisab thake ki bishi patients khan na bishi manu khan itia tak bi tai khan exact ki treatment itu orthodontic treatment ki ase ki age te koribole pare orthodontic treatment te ki advantages disadvantages itu na jane. To make awareness for them only this day was to kind of commemorate this day was introduced, and moi khan la Indian Orthodontic Society, our national association para they have the responsibility and they organize this World Oral Health Day every year in the country. And the way they do is like one of the ways this over FM radio stations, then in social media, then we go to school like we have certain camps, dental camps, which will be getting it done in certain schools also. So school te jai kina bhi awareness kura to sabi itu treatment important ase nai kun ke na lage advantages. So tai khan ke just to educate people. This is this day is celebrated. Yes.
And mujin akide kuta kura nishna. I think it's also very important because that class it won't make much difference nalito. Iku no inan no higina apni ko nishna. Spinal cord can be everything and especially our heart, cardiac level so brain and mental everything, right? So it's very important, listeners. So I'm sure we are halfway to our conversation. Apni an idea all of the bai dagiwo mujun la conversation to hunigina. Now stay tuned till the very end because I have a lot of more questions. Now yate it is all personal. What inspired you to become an orthodontist, sir?
Moi la graduation time te college se thakishe. To college se thaka time te moi khan la seniors para kotha kora thakishe na. To ki like moi la seniors means jun manu khan already masters kora ase na jun manu khan already tate professors ase kotha kora time te tai khan la ki acha alag department ki ase ki nai na. To one major thing to moi like the professor hotai koi thakishe is taila maximum patients kun ai thakishe is Baba Khan, taila bacha ke lui kina avo. Aru kovo means bacha bhi around 25-26 years. Moi itu kotha goa ase almost 15 years back la na. 15-20 years back la. To utu time te moi la professor la sa te patient khan aha time te Baba Khan nijor la bacha khan ke lui kina ase. Aru Baba ki goa ase moi nijor la bacha ke shadi koro bole na para ase. Kile Chokra Khan sahato koe taila smile bhal nai taila muk dikhato bhal na dekhi taila dan beshi bharte ula ase. To jinika moi age te bhi apni ke koise it's not only moi khan la physical health ke acha spine la dikdar ase na heart la dikdar ase itu to apni jana ase hoile bhi mental problem ke apni la confidence nahe. To because of that apni la confidence nai itu karne juntu problems ula ase which is stopping you in your life to achieve greater success. Apni confident ase apni nijor kun bhi jaga te jai kina kotha koribole pare sorom bhi na aaye. You can give interviews also without this. So itu khan kora itu karne this is very important na. To Baba Khan ai kina koe ki moi nijor la bacha ke shadi koru bole diktar pa ase. Please taila smile thik koribi. To itu time te jitya tai utu patient khan la treatment kore. Treatment kora piche te obviously smile bhal hoye dikha bhi sundar hoi jay. Piche te jitya Baba ai kina वेडिंग कार्ड लुई किना आए कोई सर अपनी तो भगवान निशिना मोइला बचा के एक नतुन लाइफ दिशे so these kind of stories inspires us to give people beautiful smiles.
Okay, that's very beautiful. Now Arabi ekta ase I'm sure agide apni la oldest patient 56 years la bi koi dagishe would you consider that the most rewarding part of your job na aro alak incidents kan bi ase?
No, definitely these kind of things are one of the like I won't say that Moila, the oldest patient is the most reward. She's also one of the reasons why I sleep with a happy mind. Now same like her जिनेगा मैं कोई शे बाबा खान आए कोई के ना कि अच्छा मैं निजोर भी इतु experience करी शे कि शादी करो बोले अलग दिखदार पास से smile करा आरो treatment करा पीछे ते ताई खान मिठाई लुई किना है आया मोइला बच्चाला शादी फिक्स हुई शे first second इतिया भी बिशी आमा खान आए कि मोइला बच्चा दो असेंबली दे ना स्कूल दे बिशी शाय था के कोथा ना करे लुकाई कि ना था के फोटो खींचा टाइम ते भी मुख बंद करे कि ना स्माइल करे मींस इतो भी आमा खान आए कि ना को ऐसे कि स्माइल ना करे फोटो भी खींचा टाइम ते ताए फोटो ना खींचाए किले शोरूम खा ऐसे इतो कोरा पीछे दे after the treatment after 1 year not even during the treatment after 6 months also amma khan ai kina ko aya ajikali to tai bishi smile kore tai assembly te bhi part lo ase school de tai photo bhi khicha ase tai la confidence change hua to bishi bhal pa ase so these things are the things of course which are the beautiful stories for us.
Okay, now in dentistry we hubi orthodontics yati bhi hubi biggest myths can be dage misconception can be dage pishina to itu olop khoi diwo apne like what are the biggest
see I'll try to name 2-3 of them. One is jinika ko ta acha braces is only 13-14 years te hi laga bole pare means 13-14 la age de bhi laga bole na pare piche te bhi laga bole na pare inika nai moila moi braces like 7 years to be braces dishe means braces bhi alag alag thage apni juntu ekta means apni tv te saishe na means bishi manu khan juntu bhabna ase munde ki loha la saman juntu dante thage sirf itu hi nai to braces to jinika moi age te koise Invisalign that's plastic braces rubber braces bi ai bishi means itu bi bishi thage to different style to treatment la age means 6-7 years pura 60 years tak bi moi khan koribole pare that's one thing. Second thing kwa to aya braces treatment bishi bikhai itu to na thage do means tha do age te kora do means age means apne suppose apne 20 years 30 years age te treatment korise to utu pura to itia to bishi advancement hoise to aji kali sabi moi khan juntu in fact wires moi khan juntu use kore na itu wires to normal ineka loha dukan de na pae do itu wires use kora to they are called as nitinol okay they are the ones itu wire to spaceship jaye na astronaut kan outer space te ja spaceship te juntu material ekta use kore na itu material para wires banai so these advancement to braces te bishi hoise ajikali wires bi aha to bishi advance hoikina wires aise to bikhala kotha to means moila 99% patients itu koi means itu moi nijor la mon pura na ko ase moila nijor means 99 patients moila nijor itu koi aji braces lagaise first 2-3 days to digdar thakibo kile nutun saman lagaise moi kan nutun juta loe nutun chashma bi loe to first 2-3 days to adjust koribole time lage na to apni 2-3 days adjust koribole time lagibo hoile bi itu piche te to apni la digdar to bishi khotom hoi jabo itu to pakka ase means moi ki go moila patient kan jinika moi bishi time patient kan ke koina come after 1 month patient kan 6 months piche te phone kore aya doctor moi bhauri she to appointment karne are apni braces treatment chola ase apni kinika bhauri bole pare daily brush kore mukte na dikhe daily smile kore aina te na dikhe bhat kha time te na jane mukte braces lagai kina apni kinika bhauri apni 6 months piche te phone kora ase moi ke appointment lage itula meaning ki ase treatment is very comfortable they don't have any trouble taila treatment bishi aram para chola ase to appointment karne hi na hai
okay now what is that 10 years ko siya apni na itya to you've been in this
Hoy,
field
Dimapur, this is my 10th year. Yeah.
10th year. So maybe one or maybe two favorite success story share gudu from your practice.
My favorite success story goa to I think the one ekta pick kurle to dimak te jundu ai na itu to mokchong la teacher hi ase jun at that age kurise our favorite ko to taila jun din braces ulaise sai moi vegetarian ase ঠিক আছে moi anda bi na khai hoile be jun din braces ulaise tai nijor cook kore kena fried rice paneer la sabji khan tai moi karne anise to moi khan clinic te boi kena moi la sathi khan alag doctor khan bi patient khan moi khan sab utu din khaise to those small things yes then itia bi inika way patient khan jundu chokmuk dima para na inika hai to tai khan means moi khan bi celebrate kore clinic te inika nai ki serious hi dage clinic te so yes when patients feel happy everything becomes a favorite success story.
And what about the most challenging part of being an orthodontist?
I think the biggest challenge is the handling the myth. Patient kan ke बुझा दो कि आया इनिका नाय कि अपनी 13 years से ही करो बोले लागे और the means मन दुख के लिए पाए बिशी टाइम patient kan after certain age है ना मुझे जिनिका कोई शे age is a very important factor in orthodontic treatment. मैं explain करा तो अपनी भावना करोगे there's a system ना कि अपनी skipping rope ना basketball खेली हुई तो अपनी till 13 years 14 years इनिका rope skip करो ना basketball खेली ले अपनी ला height increase हो इतो ऐसे ना इतो ही अपनी 20 years ते basketball खेली ले तो height increase ना हो ना कि साइंस की ऐसे इतो ते ला बितोड़े कि means अपनी ला body grow करा से body grow करा time ते अपनी basketball खेली ले अपनी ला height increase हो same था कि with braces treatment also अपनी एकता age ते because braces सही मानो खान की भावना करे braces means दांत सीधा मेरा होले भी orthodontic treatment ते हड्डी important आसे means upper jaw और lower jaw और upper jaw और lower jaw ला treatment करा तो without surgery can be done only till a particular age till the child is growing. तो बच्चा खान जितिया डांगर हुआ से 9 years, 10 years, 11 years, 12 years उतो टाइम तक ही moi खान इतो treatment करो बोले पारे इतो पीछे ते moi खान भी करो बोले ना पारे तो making people understand that I think making the parents understand that age is very important for correcting jaw problems that is the most challenging part.
Okay. Moving on, lastly but not the least, can adults also benefit from orthodontic treatment too?
Definitely say jininga moi koise hai be it whatever age na if you're not happy with your smile and that is not happy means even if at the age of 40 apni bhavna gora je I don't feel good with my smile moi khan la satni khan pra na ki bhi party te jai na ki jai मोला फ्रेंड्स खान तो पूरा जोर बड़ा स्माइल करे दान दिखाए होले भी moi स्माइल करा टाइम ते मुख बंद थाके किले बिकॉज moi सेल्फ कॉन्शियस ते इनिका ऐसे मोला स्माइल भाल नाय तो moi स्माइल करा शरम खाए उतो टाइम ते ऑफ कोर्स देन यू नीड एन ऑर्थोडोंटिक ट्रीटमेंट अपनी ला दान ठीक करेले स्माइल ठीक करेले यू विल फील कॉन्फिडेंट सो दैट कॉन्फिडेंस इज व्हाट मैटर्स अ लॉट सो फॉर एडल्ट्स आल्सो डेफिनेटली यू कैन गेट इट ट्रीटमेंट
Now, who should not have an orthodontic treatment?
See, who should not? The basic thing moi can check kora to for every orthodontic patient moi can X-ray advice kore na haddi la X-ray advice kore. So utu haddi la X-ray te moi can check kore. Apni la haddi thik thakile jinika koa sai moi la 100 patients moi check korile almost 95-96 तो इनिका आए कि ठीक आसे हड्डी ठीक आसे moi खान ट्रीटमेंट करिबोले पारे तीनटा चारटा इनिका आए जोंतु तो moi खान ट्रीटमेंट करिबोले ना पारे तो इतो एक्सरे चेक करिके ना moi खान पेशेंट के कोइ दे कि अपनी ला हड्डी ठीक ना है अपनी के अपनी ब्रेसेस ट्रीटमेंट तो ना करिबी तो those are the people.
Okay. What advice would you give to someone considering orthodontics as a career?
moi karne to orthodontics is it's my part of life na so it's a very good profession making someone smile It's lovely. It's amazing. Okay. Manukhan braces treatment kora aha pichete treatment la pichete koi ke doctor thank you so much. Now I can smile because of you. Before I had problems that I was ashamed, I was shy, I couldn't smile. Then Manukhan aha to goa to shadi kora bhi digdar thakise, itia shadi kora ase. So those things are blessing in our life. So that's why orthodontist as a career is a very beautiful thing. And jinika ko Dimapur te Nagaland te moikhan te orthodontist bishi komdi ase. To aro interior rural areas te to bishi district inika bi itia thakibo Nagaland la jun jaga te ekta bi orthodontist nai. To orthodontist as a career and profession is very very good. And then if you can go and work in the interior parts of Nagaland, yeah, amazing. Kile tate patients khan karne bhi service koribole paribo, apni nijor karne bhi career karne bhi bishi bhal ase kile you'll be the only orthodontist there, so you'll be able to work nicely also. So every way for especially for Nagaland, I would say for the kids in Nagaland who are thinking of orthodontics as a career option, it is a very very good option.
Now, as we wind up our conversation, could you share post-treatment care tips, preventive care tips for oral health?
For oral health? For oral health, there's one myth which people say that if you eat chocolates, you'll get cavities.
Yeah.
It's not. It's not.
I still believe that.
No, it's not. If you don't brush, you get cavities. See, if you eat chocolates and you keep your teeth clean, you will not get cavities. So eating chocolates is not the enemy. Not brushing and keeping your teeth clean is the enemy. So to every patient, what I say is, dinte 2 time brush kora compulsory ase, morning aru rati. Rati brush kora is compulsory. Jitia time be apni ghuma ase, ghuma agete brush kori kena. Inika nai radite brush korise itu pichete aru chips la ekta packet khabo aru pichete ghumabo. Itu to pagla kotha ase to. To ratite ghuma agete brush kori kena ghumabole lage. Dinte be apni bhat kha time te suppose school de ase, office de ase, apni brush koribole na pare. Pani ase na, pani luiwe, pani mukte lui kena rinse koriwe. Aro itu pani to sabi sorom la kotha nai, na alchila bi kotha nai. Apni pani khala pani luise, mukte halise, mukte rinse korise, pichete spit koribole bi na lage, nijor pani khai jabi na. Kile manukhan itu ko aya kot spit koribo, spit korala jaga nai to bathroom nai, wash basin nai, are apni la nijor la pani ase, nijor la mukh ase, khai jabi. तो मुख सफा करा तो बेसी इजी আছে আপনি মুখ সাফা রাখিবি আপনি কেভিটি না হবো নেক্সট ইজ গাম মাসাজ মই খান আজিকালি তো ইনি না জিম যাইবে এক্সারসাইজ কৰিবে কেলে জিম না যাইলে এক্সারসাইজ না কৰিলে হাতলা ঠেংলা মাসলস উইক হয় সেম গাম মাসাজ থাকে গাম মাসাজ না কৰিলে আপনিলা গামস উইক হয় গামস স্ট্রং থাকিলে আপনিলা দাঁত স্ট্রং থাকিব দাঁত স্ট্রং থাকিলে আজিকালি তো ইনিকা 40 50 ইয়ার্স দেবি মানুখানলা দাঁত গিৰে আছে या गम स्ट्रॉन्ग থাকিলে 70 years 80 years দেবি আপনি লা দাঁত থাকিব
তো গাম মাসাজ তো কিনা কৰে
সেবি ইজুটো তো রেডিও ব্রডকাস্ট আছে মই দেখাবলে তো ভিউয়ার্স তো না চাব হইলে আপনি ইউটিউব তে চাবলে পারে গাম মাসাজ না হইলে কিনি আছে গাম মাসাজ তো ম্যাক্সিমাম মই খানলা গ্র্যান্ডমাদার্স খান তো জানে अपनी ला फिंगर लुईवी भात खा पीछेते ना ब्रश करा पीछेते फिंगर लुई के ना मुक्ते दांते अपने just gums te roll on koriliwe itu hi gum massage ase hoile bi itu to continue kori means daily korile bishi bhal dinte 2 time 3 time apni brush kora piche te finger lui ke na gums te time roll on koriliwe samne la gums piche la gums bhar la side la gums mukh la bhitor side la gums dinte koribi bhat kha piche te ghorte ase to bhi koribi itu korile bhal aram.
So I've also heard one thing.
Yeah.
Chewing gum kaile na. Do we massage create? Is it true or
No. Chewing gum kaile, it is a type of gum massage, but chewing gum having excessive chewing gum is also not good.
Yeah.
Okay, it similar as apni excess ido gym jaile gym te jai ke na excess body weight na body training inika kora na bishi weights utha ase itu bi bhal nai same way chewing gum has its own advantage and disadvantages. You take means বেলেঞ্চ কৰিবলৈ লাগে মিন্স আপুনি এক দিনতে একটা চুইংগাম খাইলে অ'কে বেছি খাইলে ৰেগুলাৰ খাইলে চুইংগাম কেনে ৰখা আছে আৰু এইটো যদি চুইংগাম দেবি আলাগ আলাগ আয় একটাতো সুইটনাৰ वाला চুইংগাম আয় একটাতো সুগাৰ ফ্ৰী वाला চুইংগাম আয় সুইটনাৰ वाला চুইংগাম ইউজ কৰিলে এইটোতো বিয়াহি আছে কিলে আপুনি মুখতে আৰু চিনি হালা আছে চিনি হালা আছে পিছতে ব্ৰাছ না কৰে এইটো হি চুইংগাম খাই কেনে আপুনি দাঁত পচা কৰা যায়
Okay, that definitely answered my question. Now, yeah, I'm sure there will be foods that you should not have for your dental, na for your health hygiene. Huliwi, ito ki huliwi nakhaw lagi ina dos na nai.
Sabi, iniga thage to moi koi bishi hard saman na khabi. For example, ito to moi la nijor chukura moi saishe college te. Lagta sati thagi je tai over smart na tai ekta cold drink la bottle tai la habit thagi she dan pura khula karne dai try korise ekdin normally kora thagi je ekdin try korise tai la dan thi crack hoise iniga ase piche te sabi bishi tan saman thagile try koribe avoid koribole itu thage next to ase apni la gums all of week thagile moi khan apple bi khai na samne pura bite kori kena kha to itu bi apni la gums weak hoile avoid koribi chotu chotu pieces se chop kori kena piche pura khaibi ঠিক আছে তো exactly bhat khan kha to avoid tan saman bishi tan saman khawole na lage
Acha.
aru baki apni sabi chocolate bi iniga ase bishi khawole na lage sabi apni hudibo moi ke kiman chocolate khawole pare iniga nai apni kibi khai brush bhal pura koribi na mukh bhal pura rinse koribi mukh bhal pura rinse na korile apni normal roti sabji khavo na rice bi khavo rice dante lagai kena ase stuck hoi kena ase apni brush bhal pura na kore to bi apni mukte infection hobo gum disease hobo tooth cavity hobo itu hoi jabo to dant kora important ase aru kibi sticky saman khan thake itu khan thake try koribi olop kom kora aru chocolate bi sabi olop ekta duita once in a week kha to digdar nai aru idu bi go aya aji to dentist koise chocolate khaibi iniga bi nai ki daily chocolate kha ase itu bi biya ase bishi chocolate bi khawole na lage
Moi, chocolate to moi bi dhui pabi ta shi ki tat karni bi ase. I never used to chew chocolate. Ini na kai da gi. It because taste bi alag dage na. Chew grala aro ini mukti thale na rakhala. So back then I used to just put it in my mouth and just let it melt.
Are that is smart actually
Oh.
sabi apni chocolate to candy pae na eclairs khan go to apni to chew koribo itu dante jai kina stick hoi jay to jitya time tak apni bhal pura brush na koribo itu dante stick thage that is bad na to chocolate bi hoise to apni inika jinika koise apni chew kora nai itu bi bhal next thage soda আপনি কি বি ফিজি ড্রিঙ্কস লয় না না হইলে লেমন জুস বি ডাইরেক্ট লই কেনা মুখতে রাখে না ফিজি কোকা কোলা হইছে না কি বি নিকা ফিজি ড্রিঙ্ক লয় ইটু পৰা বি আপনি লা দাঁত কি কয় এসিড ইৰোজন কয় না মই খান ইৰোজন হবলে চান্স থাকে দাঁত উইক হবলে চান্স থাকে তো কি বি ফিজি ড্রিঙ্কস না লবি আৰু সেনসিটিভিটি কাৰণে মানুহ খান মৰ্নিং তে উঠা পিছেতে লাইম জুস পিয়ে না লেমন জুস ইটু বি ডাইরেক্ট না খাবি মুখ পৰা মিন্স আপনি স্ট্ৰ ইউজ কৰা খাইলে দাঁতে ডাইৰেক্ট ইফেক্ট না হ'ব স্ট্ৰ পৰা আপনি ডাইৰেক্ট খাই যাব তো দাঁত বি অলপ উইক হ'বলৈ চান্স থাকে আপনি কি বি ফিজি না এচিডিক ড্ৰিংক লইলে
Acha. That was like so much information. Thank you so much for sharing. And is there anything you would like to add up before we wind up? And anything that you think we have missed out on?
See, more or less, I think I've answered your questions. I would just like to add, or I would re-say the statements is, say we, apni la dant kiniga ase, kiniga nai, apni bhi nijor na jane, go and visit your dentist. Ajigali to every community health center means apni kun bhi interior, kun bhi chutu bosti te bhi jaile, tate community health center te dentist thage. Go and visit your dentist. Go and get your checkup done once in 6 months. Apni digdar ase na nai, chutu digdar thagile, treatment भी छुटू থাকিব খরচা भी छुटू থাকিব তো छुटू টাইম তে হি যাইগিনা চেকআপ কৰিলে বেছি ভাল তো ট্রাই এন্ড ভিজিট ইওর ডেন্টিস্ট ওয়ান্স ইন 6 মান্থস রেগুলার ব্রাশ কৰিবি আৰু গাম মাসাজ কৰিবি बस इधर ही ऐसे.
Okay. So listeners, with that, we'll end today's conversation. I hope you guys have enjoyed it. Mui karni to, it was like mui akidi konishna, nature la consultant la nishna dagishe. It's like I've visited, his clinic itself. So thank you so much, sir, for taking out your time once again and, visiting us. And itula din ikilot mana uli apni time di na yati ahado pishi thanks. And then hopefully in the future as well, Aro, when you'll have many more stories to share and when you'll have many more knowledge and experience to share with us, we'll hopefully sit together again. But as of now, we will be signing off here. So
Thank you so much for having me here. It was definitely my pleasure having a talk with you.
okay, so this is Arihant Jain and Sir Arihant, our guest, signing off.
You're listening to 90.8 Hills FM Radio.
This is 90.8 Hills FM radio station, using our voice to rate your choice. Stay tuned.